so often invisible. Thank you. Their needs are invisible, you know, the Asians mask their pain, and we think they're doing fine because they're all in calculus, but so not true. You scratch the surface just a little bit and you know, it's right there, the anxiety and the pain. And we're going to hear from this panel of experts today. Thank you so much to this panel who's come to be with us today. And I'm going to stop talking. I'm going to introduce Shelly, who's going to get going with this.
Thank you, Lori. And so it is my distinct pleasure to introduce some of the members here. But first, I just want to take a moment to kind of thank everyone for being here. And then most importantly, I want to thank my school district, the San Marino Unified School District, with our board president, Nam Jack, who supports this and the work that we're doing. And then our school district with our superintendent, Linda Delatorre, who has been so supportive because she's allowed me to utilize Dr. Stephen Choi, who is one of our assistant superintendents. And then joining me is my esteemed, but really he is really like my adopted brother. So Mr. C. Joseph Chang, who is here, and he is instrumental in getting us connected with these wonderful panelists. And so without further ado, I'm going to introduce Mr. Chang, who will say a few words. And then Joseph, I'm going to reframe the question for our speakers when you're kind of done.
Okay. Hello, everyone. I'm honored to participate workshop today. So I would like to introduce 4 excellent panelists today. During the pandemic stage, they did a wonderful job, excellent job, and they're helping the society, student, teacher, and the parent, and relief for the COVID-19. Thank you. So first of all, I would like to introduce Dr. Ruff. So Dr. Ruff is an associate professor of clinic medicine, Keck medicine of medicine at the USC. And the second one is Mrs. Anita Chu. She's a superintendent at the Garvey School District of San Gabriel Valley. Next, we also honor, we have a Miss Nina Yuen. She's serving as a director of behavioral health in the Chinatown Service Center of Los Angeles. And the last one, I would like to introduce my colleague, Dr. Stephen Choi from the San Marino Unified School District. He's a chief technology officer during the pandemic stage. He also is a compliance officer for the COVID-19. He saved a lot of the time and the effort and make our school district eventually can do it in person. Thank you. So right now I go back to our MC.
Thank you, Joseph. And I would be remiss if I didn't stop and really just thank my APISBMA board president, Lori Fong, who just is wonderful. She's a not only innovative, but creative leader. She helps make all of us better. Andrea, my partner in crime, she helps do all the hard work behind the scenes to make this event happen. And so without further ado, I want to thank everybody on the board and everybody in attendance, whether you're a school board member or a superintendent or just supportive of the programs for our API students and families. And just to get to know our panelists a little bit better, we thought we would frame their opening instead of reading the long list of their accomplishments. We wanted to open up with this question. And so my question is, you guys are all role models and leaders in your field and in the community. Your accomplishments are too many to list. We had a brief bio that we could barely fit on that slide for everybody. So can you share with us, if you will, a significant event in your life that changed the trajectory of your personal and professional life as an API? And this question will help us to get to know you a little better personally. All right. So I'll turn it over. Should we begin, Dr. Rawl? Why don't you start for us?
Thank you. First of all, I want to thank every one of you for hosting this discussion panel. It's a truly honor to speak to educators and give you sort of a perspective of where COVID is now and where we're going. So Shelly, I guess the one true incident in my life that's significantly and profoundly changed my career was when I was taking care of a young man in the hospital on my first day of my fellowship in training, as I'm going through training. And this gentleman had a chronic illness called cystic fibrosis. And it's a lung disease that affects overall, you're born with this and it affects kids and they go on to become adults. And this young man was 22 years old and in the hospital with this lung infection. And on my first day as a fellow, he looked at me and sized me up and down with his eyes and said, you're the new guy. I said, I am. It's July 1st and we have new fellows. He goes, what do you know about cystic fibrosis? I go, well, I read a little bit in medical school and I did some training in it, but I don't know anything. He goes, that's the right answer, because I'm the teacher and I'm going to teach you everything you need to know about cystic fibrosis. I go, how is it that you know so much about cystic fibrosis? And that was a really dumb question for me to ask. And he goes, I've been living with it for 22 years. I'm the expert. And from that day onward, it really taught me how it's important not to hear a message, but to listen to a message and to really understand what someone is saying to you from the words they use and how they use their emotions in those words. I think that is the most profound thing that I can tell you that affected my trajectory. And the second thing that that affected me so profoundly is when we have a special needs child at home. We were bringing her home from the ICU. My wife, a smart young woman at that time, still smart, but maybe not as young, but still smart, said to me, you know, we're all given challenges and we all rise to those challenges, whether you believe in God and in your own faith, but we can handle anything. And I have to commend the San Marino School District, where my quote normal children go and where my special needs child goes. And they've all thrived at that school. And remember, you're all given tasks that you can handle and you just need to rise to that occasion.
Wow. Thank you, Dr. Rao. Next, we have Anita Chu, Superintendent, Garvey School District.
Well, good afternoon, all. What an honor to be a part of this amazing group of leaders today. As a learning leader, I have been blessed with many great mentors who have shaped me and molded me in my growth journey. And among all these great people, this afternoon, I would like to pay tribute to one most special person, my late beloved mom. Next slide, please. And as growing up, as in a traditional Asian family, my parents, particularly my mom, instilled in me many great core values, including the importance of diligence. Just the first slide, I'm sorry. I think we need to do it as an animation. I'm so sorry about it. The little pause over here. If we can do in an animation mode, can we do that?
Oh, I'm sorry, I didn't.
No, don't worry about it then. And going back, my tribute to this one very special person in my life, my late beloved mom. In a traditional Asian family, as many of you know, parents, particularly, my mom, instilled in me many great core values, including the importance of diligence in academic learning, both of which have contributed greatly to what I have been able to accomplish in my life. But little did I know until the last 10 years that her greatest impact on my growth is something totally different. My mom passed away about 7 years ago after she had fought with a very aggressive Alzheimer's disease for 5 years. During the 5 years, she continued to stay with me, and I had the privilege to care for her. When mom became losing her memory, including my name, I was determined to do everything I can to stop the deterioration. Dr. Ra, little do I know how limited I am. And so as a well-trained educator, every day when I got home, I would put my mom through the educator's favorite exercise, drill and kill. So I would ask my mom who I was and make her repeat my name 10 times. Despite the lack of results, I continue with the drill every day. One evening after work, I was ready for the drill. I sat by her chair and asked her my most important question, who am I? This time, she looked at me intensely, as if she was seriously processing my question. And after a few seconds, with the most affectionate smile and voice, she said, "You are the one I love." Mom's words pierced my heart. Mom was telling me something extremely important, a core value that I have not yet fully embraced at that point in my life. Loving relationships. Yes, intellectual ability is great. I pursue it all my life, but it's temporal. What matters most and what lasts beyond time is loving relationships. From that day on, I stopped the drill. Instead, I started to learn to hug her and kiss her. Our loving relationship continued. Very soon my mom lost her ability to recognize anyone or talk, but our loving relationship continued to prevail beyond her physical and intellectual limitations and beyond her death. My mom has left me a beautiful, beautiful legacy, an important lesson about life, just in time to prepare me to take on a new role as a superintendent in the same year we lost her. Just in time to prepare me to serve the community with my heart, my soul, together with my mind. Thank you.
Wow. Thank you. Thank you, Anita. That was beautiful. What a tribute. Next, we have Miss Nina Locke, Director, Behavior Health, Chinatown Services. Welcome, Nina.
Thank you all. Thank you. It's an honor to be here, to meet everyone and to share my experiences. One story that really, Anita's story is very touching, and I have to give mine to my mother too, to have brought me here to where I am today. The one story that I always go back to all the time is remembering myself getting into the car after school. And this is when I was a really young girl, 4 or 5 years old. I have a lot of questions. And like many of you that have younger children, you all know, you get in the car and you have a bunch of questions and you ask and you ask and you ask. But little do we understand at that time, our parents are probably going through their own stress. They're working parents, they're really tired. They come rushing to school to pick you up, and then here you are yapping away in the background, and you ask a lot of questions. And my response from my mother was like, it was like silence. And I was like, oh, did I do something wrong? And I start questioning day after day, and I'm like, my mom isn't really responding to me as I'm expecting. Like, I'm asking for question, I'm craving for answer, and I'm trying to develop, and it really brought me nothing. And as I grew up, I started to realize that I'm not as talkative. I don't like talking anymore because it got shut down. And, more and more as I grew and understood the one class, Psychology 101 in undergrad, it did became pretty intuitive to me that, hey, I got impacted by my upbringing, my development. Something as little as that really did impact me and really did impact the way I carry myself, my speech, how I understand people. I became more of an observer versus a talker. And it's because I had to learn differently. I wasn't able to voice myself and ask more questions and, be creative using my speech. So it became more of observation. And as time goes on, I realized I have that sense of intuition and learning about other people's behavior, body gesture, because of the many years of training through observation from my upbringing. But time after time, I still appreciate my mother. I understand the difficulty they go through, and it might be cliche, but a lot of our children are actually experiencing the same thing right now. Many parents are continuing to be very busy. And do they give them the kind of attention that they need? Maybe, maybe not. And I think that's what brings me here and continue to be here and wanting to share more stories related to development and child development, upbringing, and all that. So thank you for allowing me to share.
Thank you for that, Nina. And next, we have Dr. Stephen Choi.
Thanks,
Your
Shelly.
thoughts. Hi.
Hi, good afternoon, everyone. It's really an honor to be here today, and I'm very much looking forward to sharing a few stories about our COVID journey. And certainly there are many events in life that shape who I am and what I do. But I would have to say that the COVID pandemic itself is the one event that has impacted me both personally and professionally. COVID was really personal because being a parent of two young children, ages 6 and 3 at the time when schools were forced to close, created some memorable hardships for me and my family. And I can still remember sitting next to my children when they were in distance learning. And on many occasions, I was actually having to work right beside them because I didn't want them to miss anything. Education is so valuable. We didn't want them to miss any opportunities. And while I was quite comfortable in dealing with the technology challenges, I was still very concerned as a parent because I didn't know what or how my kids would ultimately recover from this very unusual situation. And of course, the pandemic was also significant because it impacted me professionally. People often ask, how's it possible that a chief technology officer be the one to lead a district's COVID compliance team? And there's no short answer or no simple answer to that unless you really understand, what was happening in my district. And when I reflect back, it was quite a turbulent time because early on in the pandemic, it was a time when our district CBO just retired, our district nurse unfortunately quit. I still remember the moment when our superintendent at the time called me and asked, would I mind taking the lead in running the district COVID compliance team? I paused because I was still processing that. Why would someone ask me, a tech person, to run a COVID team? And the superintendent was so great at reading people. He said, Steve, it's okay if you don't want to, but he quickly added that, I think you'll do a good job at it. I think that, you're patient, you're resourceful, and you're good at working with different people across different departments. So I reluctantly accepted. I must say that now 2 years into the pandemic, I'm glad I did it. I'm glad because not only did I learn a lot about infectious diseases and public health policies, I got to implement many innovative processes that really leveraged my skills that were in my wheelhouse, which is technology. So I hope that today I'll have more opportunities to share some of those stories with you. Thank you.
Thank you, Dr. Choi. So just a great example of building capacity here at San Marino. And thank you, Joseph, again, for all of your support. I'm going to turn it back now to Lori.
You know, this really reminds me that we are in the work of human beings, young human beings, and we cannot teach and educate these human beings until we have relationships with them and that we know them well. So that's why we have stories today, and already our panelist stories have touched me. And I want to say that we are a community. We're a community right now that, you know, we've all been to many, many webinars, right? And we just kind of are anonymous in the background. We're doing whatever we're doing. One of my friends is on a walk right now, which he's listening. But please know that we are a community, and we have shared work, and that means a lot. So just thank you for being present. And it's important to recognize our kids and know them well. So just these stories, we're already knowing people well. Thank you. All right, so our panelists are going to be addressing two big questions today, and this is the first one. So in your experience as a leader in mental and physical health and wellness during COVID, what stories? Again, we're back with stories because that's where our work is, right? That's what galvanizes us. That's what gets us to spend the money in our budgets. We all know about that. What stories have touched you that would be instructive for our policymakers in public schools, in particular with the lens to our AAPI kids? And we're going to start with Dr. Rao.
I'm inspired by these stories, first of all. I think you're absolutely right, Lori. This is amazing. I wanted to sort of go one step back and sort of frame our conversation a little bit. You know, since this whole pandemic started over 2 years ago, just to give out some numbers, there's been about 80 million, that's million, people that have been infected with COVID viruses, okay? That's a staggering number. And when you look at the number of people that have been vaccinated worldwide, you see that it's about 500 million people, 570 million people that have been vaccinated to date, okay? Of those, about 250 million have received at least one dose, if not more, and you can extrapolate from there. When you look at the US population, we're talking about a 77% vaccination rate of at least receiving at least one vaccine so far to date. And that takes a drop down from about 77% down to about 65% that have completed the full vaccine regimen as outlined by the CDC and the recommendations, so forth. And that means, you know, they've received 2 doses plus or minus a booster dose based on their age, okay? The number of hospitalizations that have occurred during this pandemic are 4,500,000, 4,600,000 hospitalizations worldwide. And fortunately, you know, those rate of hospitalizations have gone down recently, and we're always concerned about whether this is going to increase in the future or what's going on with the new variant. If some of you guys have been paying attention to the news, you've heard about this BA.1 or BA.1, right? It's a subvariant of the Omicron variant, and we're concerned that this may be more infectious. But the good news on the horizon is that the vaccines are beneficial and prevent the spread of this infection or minimize the complications of this infection. Let's take it down a little more granular to our level. What's important to us? In the state of California, 9 million people have been tested positive for COVID since the onset. When we look at the number of deaths that have come from that infection, we're about 90,000 people in the state of California have lost their life to this infection, okay? Looking a little bit more closely at Los Angeles County, we see that about 2.9 million people have been infected with COVID infections. And of those 2.9 million people, 32,000 people have lost their life in our neighborhoods, in our city. A staggering amount. Yeah, that's all numbers, and you know, numbers are numbers. And at some point, as these numbers are sort of spewed to us, and depending on different news agencies, flash in the corner, or on the top, or the left, or the bottom somewhere, and we look at those and we've become numb to that. Unfortunately, as the pulmonary critical care doctor here at USC, those numbers have meaning. These are people that I've had to go into rooms and had to come out of a room and call a family member and say that your father, your mother, your grandmother is not going to survive this illness. I don't have anything else to offer, and I don't have any way of ensuring that the amount of oxygen that they need for their brain and for heart and their lungs and their kidneys and their liver is enough. I don't have any other technology that I can use, and this infection has overwhelmed their body. It's very, very outlandish and very soul rocking that we have to do this every day when this pandemic was going on. To be able, not be able to be home with our own loved ones because we're afraid of this infection spreading to our family. As I mentioned, my daughter has special needs. Our biggest concern was that if I was going to bring this infection home to her and her immune system was diminished, would this overcome her? My wife and I made this decision that I would not be coming home while I was taking care of these patients, and elected to stay at a local dormitory on campus for 1 month at a time and go home for 15 days after I was tested and found to be negative for COVID infection before going back home and being with my family. You know, Nina, you talked about withdrawing and not being able to communicate. All of these things severely affected my own family life and how I would interact with not only my wife, but with my kids as well. You know, it's hard to find relevance to not being able to go out and down the street when you're seeing someone dying in front of you, or not being seeing the relevance of a child saying, I wish I could go to the movies, when you're thinking about the patient that passed away or the patient that's going to pass away in the morning when you go back to work. These are all things that, you know, as physicians, we're trained and try to handle, but I don't think there's anything that I could have anticipated in my training for such a magnitude that we had experienced. You know, early on in the pandemic, we were seeing older Americans that were getting infected and dying from this infection. The average age at that point was 65, 70, and you know, that was the biggest concern, was the older American that was going to become sick and couldn't overcome this infection. Since the pandemic has shifted, we've seen a shift in who is becoming infected and who is able to resist this infection. And the one thing that has changed this trajectory has been the invention and the use of the vaccine in a timely manner and the booster dose that goes associated with that. Because of that booster dose and the immunity that's been offered to these populations, there's been a shift of the people coming into the hospital and those dying from COVID infections to younger and younger. We've gone from an average age of 65, 70 down to 50, 45. And sadly, you know, in speaking to my colleagues in pediatrics, we're seeing younger and younger young adults and adolescents and children that are being infected with COVID and are learning to live with it and hopefully survive from this COVID. And the last point that I'd like to make about infections of COVID and the complications that are associated with COVID is this long COVID syndrome that we're starting to hear about and learn about. We're so early in this game that I don't think we fully understand what long COVID is. But what we do know about long COVID is it not only affects organs, meaning it affects the muscles, it affects the kidneys, it affects the heart, it affects the lungs, but we see that it affects the brain, and it also causes psychological injury to these people that have infections with COVID. Now, it's said that in the adult population, again, as I mentioned early in the framing this question, when we looked at the adults, we see that about 10% of those people that are infected with COVID go on to develop sort of a long COVID, and about 1 to 2% have persistent long COVID that lasts longer than 6 months. Now, if we were to extrapolate that into our younger population, as kids become infected, sadly, I don't see how that same percentage will not go on to the younger kids in our care. And I think we need to do everything we can to prevent the spread of this infection and the potential complications that arise from not only the acute phase, but the long phase as well. With that, I'm going to get off my soapbox for a minute, okay?
Okay, thank you. That was really a heartfelt share from someone on the front lines. I appreciate your work, Dr. Rao.
Thank you.
Nina Locke, same question.
Yeah, so mental health is typically not a topic or conversation in anybody's daily conversation, you know, especially in the API family, in the Asian family. And, you know, unfortunately, despite race or socioeconomic class, mental health affects everybody and affects anybody the same way it affects anyone. But Asian American are 3 times less likely to seek help. And of course, the biggest reason is stigma that surrounds mental health issue. And then on top of stigma is the lack of understanding and awareness of what mental illness is and where to seek for resource. Where do they look for help when they do develop some understanding and want to know more about it? There's a lack of understanding of where resource could be found. In 2020, there was a decrease in referrals to our agency when it comes to serving the children population. And that's, as you could look at some statistic here on this slide, it's what was really reflected in our organization. We also had a decrease of referral. But unfortunately, when we did receive those referrals, this children or the child that's on the referral on that one piece of paper, they're either already in the ER or they were in a state of emergency. You could go ahead and move on to the next slide. One of the challenge that Asian American faces is the pressure of the model minority. One of the story that really affected me in the last 2 years was a 17-year-old girl. She requested therapy with her mother, but her mom dismissed it. So she was resourceful, which is fortunate in that way. She was very resourceful. She went to a school counselor and requested from the school counselor. So the school counselor found us, and because we're culturally competent, like they wanted to match somebody with the being able to serve the API population. So when we received the referral, mother had to consent. She was a minor, so mother did consent though, so that was a good thing. Through the assessment process, our therapist realized that she had to pay closer attention to this individual. She had to provide daily contact to make sure that she's safe. And the reason is because she had active suicidal thoughts. She was actively planning. So we were really concerned for her safety. And we brought the concern to the mother's awareness. But going back to the model minority, the mother continued to dismiss her challenge, the challenge her daughter was facing. And she just said, she kept telling us, like, you know, she's just trying to get out of school. She's trying to avoid her homework assignments. She doesn't want to do school. It's academic. She kept relating it back to academic. It got to a point where mother wanted to cancel therapy and said, oh, it's therapy is just not helping your child, my child. Like, she just thinks it's causing more problem. Well, unfortunately, I got to a point where it was considered as neglect, safety concern. It was a neglect, and child welfare went out to their home to do an assessment, and it got to a point where the child had to be admitted to psychiatric hospital involuntarily. Sometimes it's things like this that, you know, every family have their own expectation. It's either the child trying to live up to family's expectation or societal pressure that really kind of spiral down to mental health and get the child, like brings the child to where they're really at. Either depression or anxiety that gradually develops. So being able to see signs at an early time and have some preventive care is really crucial. That's one of the many stories. There's actually another one that really did touch me too. It was actually a call directly to my line. And the mother shared that she needed therapeutic service, not only for herself, but for her son, who's currently at that time was in the psychiatric hospital due to depression. For a mother to request for service herself is really big from a Chinese mother. To come to awareness that she needs to help herself in order to help her child. It's a big step. And it really hit me because the mother is really brave to be able to verbalize that, to tell, you know, another individual that she needs help, because we don't typically see that. It's usually the child's fault. It's usually academic issue. It's always pointing at other individuals versus her own a parent. Her son at that time was admitted to the psychiatric hospital, and she felt really guilty. She didn't know why, what was happening, what was going on. She shared that her son was getting good grades. She never saw any signs. And, you know, what do we do? What can we do to help these API students sometimes? Because it takes a little bit of a different approach sometimes when it comes to serving the API students. Signs could be more invisible, or it could be more subtle when it comes to mental health with the API student, because they'll keep up with grades. Many of them could keep up with grades, and they'll actively participate in school projects. But some of the signs that we could learn to pay attention to are like low energy, their lack of interest in bonding with each other or with anybody, with their own peers. They could have flatter affects too, in any situation. So those are more like subtle signs, and some things that we could do is really create a safer environment. Have like check-in with the student that if you feel like you're developing some concerns with, is to have like check-ins, develop that rapport. It's that relationship of getting to know one another that could really help the process, because they might not be getting the attention that they get at home. So for them to hear that somebody else might be interested in what's going on in my life, that relationship and that rapport could potentially happen really quickly, actually, because they don't get it. And all of a sudden somebody's craving into and feeding into their curiosity. So it's like that rapport could just like miraculously develop. And that's how we could really tap into serving children, students that are having more subtle mental health issue, and that might not be seen like really upfront. Yeah, so that's the two story that really impacted me, and some ideas of what we could do and approaches we can use to serve students in the community, in the school district.
Thank you, Nina. Scary when parents don't listen to their kids. It's just a cultural thing, which we see a lot in Asian culture. Thank you. Superintendent Anita Chu, we're going to hear from Superintendent's perspective. So thank you again.
Thank you. Yes, from the lens of an educator. Well, needless to say, COVID has redefined the role of education. As we all know, for decades, actually the concept, the notion of whole child development has been a well-recognized notion among educators worldwide. Asian educators would describe that as 5 goals of education. 5育，德智體群美. Now here, we talked about the importance of moral, intellectual, physical, social, and aesthetic well-being. However, we also have experienced in reality, in the context of the high-stakes accountability system, and particularly for API families who have the highest regard for academic achievements, the focus in American schools has remained to be predominantly academic learning. The COVID challenge, however, has necessitated an important shift in practice. Whole child development has turned from being an espoused theory to a theory in action. The COVID experience actually has impressed upon us that we have to really touch the heart to earn the right to teach the mind. Very much like what we have been hearing from our panelists. So here are a couple of beautiful stories that Garvey had experienced that really help us to understand the heart-mind connection. So let me introduce to you, I know that there's really no animation, so you have to pretend that you're looking at these pictures in a progressive manner. So, okay, let me start with the leftmost picture. So let me introduce to you this 4-year-old wonderful student, our 4-year-old Kenneth in our Head Start program, who comes from a low-income family. He's diagnosed with orthopedic impairment and is in wheelchair. Recently, he had a surgery. Now, after learning that his only wish was to ride a bike, our staff brought him a little surprise one morning. He sure was surprised. I wish you could see that picture. You could see him that morning. He was all smiles. Our staff do understand the heart-mind connection. We do understand that a happy child is a learning child. So now let me introduce to you another youngster, a 1st grader, Jason. On the first day of school back in August, Jason literally grabbed everyone's attention with his rather unique outfit. So in addition to wearing a face mask, he wore a face shield like the one that you see in the picture. He also has a plastic lab coat that covered him from his neck all the way to his feet. In addition to that, he wore blue heavy-duty plastic gloves that covered past his elbows, and he stayed away from everybody. So on a side note, you know that Jason's family, probably like many of our API families, had a very conservative perspective regarding the COVID situation, probably due to the SARS outbreak experience in Asian countries about 2 decades ago. So back to Jason. So his excessive attire conveyed a clear message to us. He was afraid of COVID, and he was feeling very anxious being around on campus. So some months have slowly passed, and our staff have worked ceaselessly, particularly at that school, to strengthen the safety measures and to manage the COVID challenge. So today, if you see Jason at school, you see that far leftmost picture. So he's smiling, playing with his friends, and sometimes tattletelling who's not being nice on the playground. So he's back to what a 1st grader should experience at school, feeling safe, worry-free, and enjoying himself at school. So both of these stories convey a compelling message. During difficult times, especially when the physical, social, emotional wellness of our students is being challenged, putting the focus on the wellness of the whole child is pivotal to achieving our educational goals. So we do have to touch the heart to earn the right to teach the mind. And remember, a happy child is a learning child. Thank you.
Thank you, Superintendent Chu. Those kids are adorable. Stephen Choi.
Thank you.
Living COVID also. Mhm.
Yes, yes, yes. Thank you, Superintendent Chu, for sharing that very heartwarming story. I actually attended Garvey schools myself, kindergarten all the way through 5th grade. So so very heartwarming, and thank you for sharing that story. And so I like to share some of the touching stories that happened in our district. And most of those stories are really related to the tremendous outpour of support through partnerships. But before I go into those stories, I want to share one about courageous leadership. I think back to a very important date in my mind, and that's March 10th, 2020. As many of you may recall, it was around the time when the pandemic just started, and we, like many schools at the time, were just quite unsure about how to respond to COVID-19. And this particular day was truly etched in my memory because it was the same day that my mother called me right before the start of a school board meeting. And my mother knows that I typically work late on Tuesdays. So for her to call me during this time, it must have been something important. So I took the call. And so she called me to tell me that she was lucky enough to purchase the last box of N95 masks from someone who was selling them out of a car at an Asian market parking lot. And she called me to offer me not just one, but a couple of masks. So I was obviously very concerned, and obviously I was very touched. So I responded, "How much did you pay for them?" So it's I won't share how much my own mother paid for those masks, but what happened after that phone call was something that was truly inspirational and courageous. That evening, our very own school board president, Mr. C. Joseph Chang, donated 10,000 masks to the San Marino Unified School District. And I later learned that not only was Mr. Chang's donation a generous act, it was one that was an act of courage. 2 years ago, Mr. Chang received a lot of criticism immediately following his mask donation. And some claimed that schools simply didn't need the masks, or that the coronavirus was just not that big of a deal. And when we fast forward to today, I'm extremely proud to share the story of Mr. C. Joseph Chang, who's an experienced public health executive with the foresight to see the value of masks, and for having the courage to really inspire others in the face of criticism. Mr. Chang's donation was only one chapter among a series of stories that would later inspire others, individuals, organizations, to partner with our district to enhance the safety of our staff and students. So I'll share a few examples. For example, Mr. Chang introduced us to the leadership team of Keck Medicine of USC to help us secure COVID-19 vaccines for all of our employees when the vaccine was extremely scarce. And it was around that time when we were hearing stories about people paying a premium or even lying just to get ahead of the line to get the vaccines. And later, Mr. Chang also helped us jumpstart COVID testing for all of our staff through the Chinatown Service Center. And he built these bridges to bring mental health and wellness resources to our schools. And stories like this, they were routinely shared in our district and ultimately inspired others in our community. And it inspired so much that another parent in our district, he was operating a pop-up COVID drive-through test site, learned that our schools really needed a way to fast and conveniently test our students. And this parent was also inspired by Mr. Chang's efforts, helped connect us with a lab that would send teams of clinicians to visit each and every one of our classrooms to swab students and staff noses throughout the week. So there are many, many stories like this, but I'll wrap up with one more. Many of you here today are policymakers, and you have the opportunity to create partnerships. And in many cases, many of you have done that in your districts. So I encourage you to continue to lead with courage, trust your instincts, and do what's best for your students and communities, even during these times when there's extreme criticism. And most importantly, just like what we're doing today, share those stories. Share your stories, not to just toot your own horn, but to inspire others to partner up and do what you believe is right. So for those of you that are like me, working in schools, whether it's being a parent or maybe just that person who still answers that phone call, I wish to sincerely say thank you. Thank you to all the C. Joseph Changs out there for leading our schools through this pandemic, creating partnerships to find resources that money sometimes cannot buy, and truly just being an inspirational leader. Thank you so much.
I'm being inspired all over the place today. Thank you, Dr. Choi and Mr. Chang. Shelly's got our next question. Well, she'll cue that up for us.
All right. Thank you so much. I am so moved by all of your experiences, and thank you so much for sharing these stories with all of us. Instead of what we had planned was to take questions from the chat, but I thought in the interest of saving some time, I need to maybe move on to our next question. And so I'm going to frame it this way. All of us have talked a little bit about our own experiences, which is kind of unique to our position. My question to you is, what is important for our districts and our school leaders to know, and to know the why of what we're doing? And this can include you giving examples of best practices or what you notice might or might not be working. So that's the question to frame your discussion. And so I'd like to start again with Dr. Rao.
Great question. And these are all challenging questions. From a healthcare provider point of view, I think the most important thing we can go forward from this point is to limit the potential complications of this virus. I mean, I think when we started this pandemic, we were all thinking that, hey, we can get this under control and we can move on. It'll be a fixed period of time. Early on, everybody was saying, oh, 6 months, maybe a year, and we'll be okay, we'll be out of this. Now we're at 2 years. And I think our focus has changed from we can get over this to how do we live with this COVID infection? And how do we position ourselves to have the least effect of this virus that has so profoundly infected our lives? I mean, I think the one thing that I can say is wash your hands. Second thing is wear a mask. We know that the mask is the best deterrent for acquiring or spreading this infection. It prevents the infection from going into the respiratory tract or into the nose and into the mouth. We know that it prevents a virus from spreading from the mouth and the nose to the rest of the environment. So even before people can know that they're infectious, this mask prevents that spread, and afterwards it prevents you acquiring. Just my own personal preference for my children, I have told them that I would prefer that they did not take the mask off while they're in school. But, you know, as you can expect, a 16-year-old is susceptible to peer pressure around. And I have to be mindful of that. I can't expect a 16-year-old that walks out of my house and goes to the school is going to continue to hear my words in the back of her mind when she has other input from her colleagues and her friends and so forth. But I can at least educate her to the importance of that. The second is the vaccine. I know of a lot of disinformation about vaccines and so forth, but I do honestly believe that this vaccine, whichever vaccine the family chooses to use, is the cornerstone of preventing this infection from complicating their child's life as well as their own health. And, you know, I will leave it up to the data as to which vaccine is better. But in my mind, any vaccine is better than no vaccine, period. okay? Lastly, as we go forward, I think it's important for us to remember that this is not just a physical illness, but there's a huge component of a mental illness as well. This last month, as the relaxation of outdoor dining or indoor dining and indoor events were eased up in the Los Angeles area, my wife and I made a decision that we need to be a part of the community and start to re-socialize our family, our kids, back into the environment. Just as Superintendent Chu has pointed out, you know, our children were petrified about going and sitting in a restaurant. We said, we're going to go sit outside. We're going to take it gradually. We're going to sit in a patio area and we'll take our mask off for just the food and go from there. You know, we are social beings. Our children are social beings. And we need to get to a point where with prudent measures of vaccine and mask, we can go back to being social beings again. I think it's important for the development of children and the nurturing that goes on with being social. My 16-year-old, my 18-year-old, they enjoy being with their friends. They enjoy talking to their friends. And they are being reasonable about doing it in a manner that is befitting their own anxiety that's associated, but pushing back towards being normal again. And we have to be clear. The new normal is that, a new normal. We're not going back to a day where everybody just haphazardly does whatever they want. There is going to be some new field that's going to be out there, okay? And masks and the vaccines are going to be a part of that new normal.
Wow, thank you, Dr. Rao, and thank you for your expertise, not only as a doctor, but as a parent in helping us to really balance not only the physical safety, but the social, emotional, and thank you for that. I'd like to go to Anita. Superintendent Chu, please.
Sure. Well, as we all know, there has not been a silver bullet to address all the COVID challenges. In fact, we're just beginning to gain a deeper understanding of the specific impacts of COVID on our children and families as they return to in-person interaction with us. Despite the limited knowledge, though, there have been a few high leverage practices that have helped Garvey mitigate at least the short-term impact of COVID and have supported us through the last 2 years. So allow me to highlight just a couple. And the first and foremost, I'm going to echo what Stephen had shared, partnerships. We could not have, Garvey would not have had survived through in such a strong and powerful manner without a strong partnership with multiple community agencies and Institute of Higher Education. So the partnership with, for example, the partnership with Hero Christian Health Clinic and IHE has enabled us to provide on-site vaccination clinics in an ongoing manner. A total of 8 events so far, serving over 3,000 students, staff, and community members. And secondly, the partnership with Chinatown Service Center last year and then this year with COVID Clinic have allowed us to provide weekly COVID testing at all sites for all students and staff, providing both PCR within 24-hour turnaround time and antigen rapid tests. During the craziest time when no one could find any testing services, our staff actually had to send their own family members to our own on-site testing services. So very, very blessed with these partnerships. And the partnership with our after-school service providers have provided us with additional support staff. There have been a time when it's not because of the money. There were no additional staffing that we could gather to assist us with the daily health screening and also the student supervision. And our after-school service providers had lended their helping hands and provided us now about 3 additional staff on a daily basis at all the sites. And there was a time during the most challenging days that we were able to get 10 additional support staff for every single one of our schools. And that has been an amazing. So even though it's an old saying, it is true that it does take a village to educate a child. And in this COVID situation, it does take a community of partners to make sure that we provide a safe in-person environment for all. So in addition to the safe environment and being blessed with multiple partnerships, early on during the journey, we have come to the realization the immediate need of a strong program to address the social emotional challenges confronting our students' family as well as our staff. So our district immediately adopted a couple of SEL, social emotional learning programs that include research-based high-interest strategies and activities, as well as assessment tools that help us to identify both explicit as well as implicit signs for intervention. We also, to the extent possible, hire additional staff, including counselors and behavior assistants to target our high-need students. Additionally, quite a creative approach, each of our schools now have been invested in designing and also creating a space called Wellness Center. It's a designated room purposefully equipped with furniture, decoration, and setup that are conducive to SEL activities for students. In fact, our staff love this idea so much that now they're asking for a wellness center for staff only. I myself have visited a couple and actually did not want to leave that wellness center, but it did allow us to have a space for reflection, to gain a new perspective. So I know that our staff and our students have been enjoying this new addition to their campus. So as you know, that effective implementation of all these new initiatives obviously have to be supported by ongoing training and collaboration opportunities for staff, which we have been trying to identify time and opportunities to allow the staff to come together. And all these measures, based on the last year and a half particularly, have contributed greatly to our strong journey in mitigating at least the short-term impacts of COVID. Now, however, if talking about lessons that we learned, to make sure that our system is best prepared to promote whole child and whole family wellness, as well as to cope with any future surge or pandemic, God forbid, there is a need for long-term investments, particularly at the policy level. We need policies that promote partnerships between school districts and community agencies. Policies that provide resources for additional health and SEL staff. Policies that incorporate SEL in teacher credentialing programs. So we know that even though we are certainly in a better place, our journey together will continue. Thanks again.
Wow, Anita, thank you so much for highlighting some of the components of what you were able to implement in terms of social emotional learning, and those partnerships have become so important, almost making our schools communities within themselves. And thank you for sharing that. Next, we have Ms. Lena Yenlock, who will share with us what she thinks we need to do.
Yes, so before we move on to answering that question, I know there was a question pointed for me, was whether the data provided earlier is specific to the API population with children. Well, that statistic that I provided earlier, where it was actually more of a general statistic, and it was not really geared toward the API population. So I just wanted to answer that question first.
Thank you.
And moving along with the question, thank you, Anita, for providing those information. And I really wanted to piggyback and also elaborate on what was shared in terms of the wellness center and also training, coming from a behavioral perspective and also more of a preventive care lens. I want to bring up mental health first aid, mental health first aid training. This training in particular, really, we want to prevent the stories that I shared earlier. We don't want to receive referrals where the child is already in the ER, or referrals where we have to do a close monitoring because they're actively having suicidal thoughts. But how do we get there? What is helpful? And it's mental health first aid. I would want to, is what I really feel would be really helpful to the school district and to the community. Mental health first aid comes in 3 different models. There is the adult version, the youth version, which is really more helpful, geared towards school personnel and school administrators. And there's soon to be a mental health first aid teen version, where we're training the teens on how to talk to each other, how to help each other when they're seeing signs of their friends experiencing anxiety or depression. How do they talk to each other? But that's in the near future, and that's more to come on that. But in the meantime, it's mental health first aid, the youth version of it, that I find will be extremely helpful for school district. It will help school personnel see signs and factors and know how to de-escalate a situation before it becomes a crisis. And from there, how to get resources, where to look for those resources. Because we all, being in this field, we understand in the API population, awareness or understanding of mental health is still an area that really needs more time and effort to be put in, into the community, so that parents understand what mental health is and how it really does go hand in hand with physical health. I think the silver lining of COVID is it pushed mental health awareness to the forefront of how important it is to any individual in this world. The lack of social interpersonal connection does become, it does have a negative effect on human and development. The next thing I wanted to bring up is trauma-informed care. If schools are incorporate trauma-informed care approach, my next slide has like 3 specific areas that, if we could move on to the next slide, sorry, I need, you'll be able to see that there's the creating the safe environment where I shared earlier is really important, but it'll help build that connection and that relationship with children. And also the piece of mindfulness, teaching every individual how to regulate their emotion, how to see their own signs of reading their own stress level, knowing what pushes them to feel stressed, where in their body they feel that, and what to do when they feel that stress is coming. What does anxiety feel like? How does depression look like? And what triggers them? What makes them angry? What makes them happy? All of these have to do with mindfulness, and being able to have like an environment where they can feel safe to learn that and to be able to react to certain things that happens in their life will create a safer school environment and safer community as a whole for both teacher, parents, and the community as a whole. So those are really some of the more preventive care perspective, really coming from a preventive care perspective that I wanted to share, that I have seen work, and hopefully from a policy making level is to maybe incorporate some of these into training, school staff. I know there's times already designated to teacher to receive training, but maybe we can also consider having this tied into their curriculum annually. You could be certified and you can, really help prevent children from going into a severe mental health issue. So these are some of the items that I wanted to share.
Wow. Thank you, Nina, for putting the focus on first aid for mental health and really for sharing the trauma-informed practices in terms of creating that safe space so our policymakers can see that as a primary focus, as well as that self-regulation and also the mental health piece, not just the social, emotional, but that wellness with mental health. So thank you for that. And finally, bring us home, Dr. Stephen Choi, you will be our anchor for this question. What is important for districts and school leaders to know and to understand the why? And how can we talk a little bit about best practices as we have experienced?
Thanks, Shelly. Yeah, I would say it's important for school leaders to know that as a result of COVID, there has been a remarkable adoption of technology. During COVID, technology had quickly become essential to so many industries like retail, food, or even healthcare, right? So when I think of the retail industry today, I think about how convenient it is to pre-order something on my mobile app and just pull up curbside so that the purchases could be placed into the trunk of my car. And when I think of food, I'm reminded about how efficient it is to order exactly what I want, streamline the entire payment process, and even save it for a future favorite order, right? And obviously with healthcare, huge strides there. I appreciate how much more accessible our healthcare professionals are through the use of telemedicine, and how much easier it is to even understand reports, things like blood tests that really take meaningful data and translate it into life-saving actions. So, while a lot of this technology was being adopted during COVID, industries flourished, and education was really no exception. I believe people's experiences and their expectations can cross-pollinate from multiple industries and transfer into education. So in my district, technology adoption also accelerated very quickly. Teachers and students were highly motivated to connect and to interact with each other. When we think about how school workers, teachers, special education staff, technology, food service workers, they really had to reimagine how they did their work. So in many ways, the accelerated use of technology felt like a big experiment because people creatively worked around all of these restrictions, and they were really willing to try new things. So, as I say this, I'm looking at board member Shelly Ryan, who commonly asks why. Why is this important? Well, Shelly, here's why. This level of technology adoption gained during COVID will continue to be essential in schools because technology can improve and can enhance learning. It can address learning loss. Technology can increase engagement. It can instill wellness. When I reflect on all of the initiatives that we implemented during COVID, nearly every aspect was enhanced with the use of technology. And looking at the clock, I'll share one story in terms of how we did that. One major accomplishment that I'm extremely proud of was how we used technology to improve customer service and satisfaction during a time when patience was simply running very low. One situation that we saw occurring at many schools was that families were often idling in drive-throughs, right? They're waiting in line, picking up Chromebooks or hotspots. And I'm pleased to share that our district managed to distribute thousands of devices, things like hotspots and Chromebooks, to nearly every family with an average of less than a 2-minute wait time. And the secret ingredients here are really not all that secret. It's really just using a combination of technologies. And we did this by using things like Google Forms to get requests. We used Google Sheets to stagger appointment times. And we utilized communications tools, things like GMass, for example, to automate personalized messages. Our families were so happy about that. They were so appreciative of how efficiently and how smoothly things ran that, even after picking up their device, some of them drove back and actually dropped off donuts and refreshments for us. And, we learned so much from these experiences that we applied similar technologies to automate and to manage things like our COVID vaccine and testing clinics. So I want to wrap up by highlighting one more important practice, which is how technology can make our schools more inclusive and more welcoming. School leaders often have to make decisions, but sometimes you may not have all the data, or you're often informed or influenced by a few that are simply just more vocal. And school leaders should consider using more technology to get input and to get feedback to make data-driven decisions. My message for all of our leaders here today is don't forget to leverage technology and bring your technology leaders to enhance your practices, because by doing so, you're not only creating an organization that is more efficient, but it's also creating an organization that's more inclusive for all of your students, your staff, as well as your community. So I'll end it there. So thank you very much.
Wow. Thank you, Dr. Choi, for answering the why and for sharing with us the implementation, the revolution of technology as it is utilized to help us with this new normal. So thank you for that and your experience and expertise. With that, we are nearing the end of our program, but we have questions and we have a large group listening and waiting to kind of get their questions in. So I'd like to bring back, if he's not too embarrassed, Mr. Joseph Chang to come back in and Lori to come back in. I also have a story of Joseph as well. I was getting ready after a year of distance learning and the schools had been closed. And I was a little bit concerned because I work at 2 sites, and that's about 1,300 kids, about 750 on each site. And I said to Joseph, I says, I'm a little bit nervous about going back to work, and I didn't even have any masks. And so what does Joseph do? He goes home and he drives over the masks and he goes, here, you be safe. And he brought masks for me and my entire family. So Joseph, thank you for always taking care of your colleagues and San Marino Unified School District. So I hope you weren't too embarrassed by Stephen's stories of you, but I thought they were wonderfully told, and that I hope that we all enjoyed all of our stories and our experiences, and that it moves all of us forward. Lori, I'm going to turn it back over to you and to Rosa and Andrea for all the questions.
So we thank everyone, and we thank all our listeners today. And we have recorded this, and we will have this posted. And I think we covered a lot today, and it was, again, inspiring. Not just for API kids, but certainly for best practice for all of us. So I am going to put up a poll right now. It's a survey. We just wanted some feedback as we continue to bring Zoom workshops to school board members and leaders throughout the state of California, again, with the eye to API kids. So go ahead and take a second to do that. If you had any more questions, you could put it in the chat. And while we're doing that, panelists, if you have any last things you'd like to share with us that you didn't get to say, please. Good time right now.
As a parent of kids, I would like to thank you for all of the ways that you as educators have pivoted during this period of time. Dr. Choi and the members of the San Marino Unified School District in particular, I can speak to you of personal note. My kids hit bumps on the road and are now thriving as they go back to in-person learning. And the amount of joy that they have had in doing teleschool or school from home and now being back at school is fantastic. There's a smile on my 16-year-old daughter as she talks about the interactions that she has with her friends and all the wonderful ways that she's learning back in her chemistry class and her biology class. So from me, thank you.
All right. So go ahead and bring up the poll. Andrea, do you want to come in and make some announcements? She's so hardworking, she's probably not even listening to me.
I am. Thank you. Well, I want to thank everyone for our speakers, our attendees for attending. We do have another event coming up on April 29th, and it's going to be in San Gabriel Valley, and more details to come, and it's going to be an in-person mixer. So.
All right.
Okay, I've got a burning question for anybody who's still here. So the mask mandate has been lifted. My own district is strongly recommending, and they're not going to have to. And like you said, Dr. Rao, you can choose, kids can choose their own. And it's kind of like we direct our little ones and they kind of follow us, but we know that kids give into peer pressure. I'm a little bit worried that the peer pressure is going to say no masks, and that our API kids, let's say high school kids, mostly secondary kids, any API kid that's still wearing their mask might be a target. I don't know if that's true or not, but nationally we're looking at hate and anti-Asian. I mean, something happened. Somebody said something to me at Costco, not too kind of early on in the pandemic. But anybody have any ideas about this? What the recommendation about masking is for strongly recommend?
Okay, I have some suggestion. Actually, the last Saturday, I attend our parent party. During the COVID-19, the huge parent, they have a different opinion. So then they attack me during the school board meeting. But last Saturday, I know the San Marino vaccination rate is go to more than 80. So now I know our community is safe. So I actively and directly and go to that parent. I shake a hand, and he was so shocked. He thought we were always like the enemy. But since I shake hand, I think he tried to hug me. I also shocked. So what I'm trying to share with you, as a public health hospital administration background, we really like to know what is the science data. You need to know in your school district what is the vaccination rate. If it is very low, actually they have a risk. So even the LA County Health Department, they say right now, no mask, but it's optional. I think the student, they really need to, the parent, they really need to give them some education, because you are challenged with yourself, not to the other, because each person, their immune system is different. Yeah, some, even no vaccination is okay. Yeah.
Well said, Dr.
So that's my personal.
I would add that your thought of killing them with kindness is such a good way to approach anyone that is intimidating you or trying to bully you. That's the same advice that I gave my daughter. I said, tell them that you're doing it for their protection, not only your own protection, and that you want to continue to see them. And if they don't see it from eye to eye, it's okay to walk away for that moment and then come back and visit it again later and see if they're truly your friends or not. I think the idea of de-escalating with sort of rationale and with sincerity and with good intention can be tried. But if it doesn't work, you have to think about your own safety and pull back. That was a difficult discussion to have with the kids, but I think they understand it. And again, my kids are at a different age and a different thing, and you have to decide how you're going to approach it with your own children at whatever age and development that they're at and that they're able to understand.
All right.
And do we have time for one more minute?
Go ahead, Anita.
Oh, yeah, sure. So my message to my administrative leaders has been the following. I share with them that this is the most appropriate teaching moment to teach respect for diversity and to go deep into understanding why different people may have different perspectives, why we may have physical family situations that may necessitate us to have a different choice, different from others. At the same time, how powerful it is to lead by example. So I have administrators who have purposefully decided to leave the mask on or off to serve different purposes. So as they see the respected leaders at the school, having differences even among the team, we have teachers who wear it, who don't wear it, administrators who wear it, who don't wear it. They know that actually both choices are to be respected. So I think, lead by example is also another powerful, subtle way to deliver this powerful message of respect. Thank you.
All right, wonderful. Well, with that, the survey has been launched, right, Lori? The survey has been launched?
We're done. We're good.
Okay.
We'll take a look at it
Okay.
later.
Okay, and so I want to thank everyone for joining us, and thank you so much.
Thank you so much, everyone, for joining us. To our panelists, a special thank you. We wish everyone a great week, a healthy week, and good wishes for your school districts as well. Thank you.